The combination of Nobilium's strong Masad Denplant low temperature tray and Perfit putty and Perfit light body enable you to take a final precise impression with only one patient visit. No need to waste time and money on a custom tray. The following video will show you the two-step impression technique using Nobilium's strong Masad Denplat tray and Perfit impression materials using a maxillary model for demonstration. There are three sizes of Denplat trays developed by Dr. Sam Strong and Dr. Joe Masad. Choose one size from small, medium, or large of Denplat trays. The tray is fully adjustable in less than a minute after placing it into a hot water bath at 165 degrees. After warming, place the tray directly into the patient's mouth and adjust it to the dentition. The tray should be 3 to 4 millimeters from the patient's teeth. You can also reheat the tray and make indirect adjustments. The patient should rinse their mouth for several times before the impression procedure. The clinician should use non-latex gloves to avoid impression material adhesion to gloves. Using the Perfit putty, scoop the base and catalyst in equal proportions with measuring spoons. Use fingertips to thoroughly blend the materials for at least 30 seconds until the mixture becomes well blended without color streaks. Avoid to using the center of palms as the higher temperature will shorten the setting time. Roll the putty into a cylinder and then insert it into the tray. And finally, insert the tray into the patient's mouth. Allow to set for 3 minutes. While waiting for the impression to set, press the material to feel the resiliency with your finger. Polyvinyl siloxane silicone impression material is sensitive to temperature. The higher temperature, the faster the setting. We therefore suggest to keep it in refrigerator in summer to extend the setting time. Before applying Perfit light body impression material on the first step impression, use Perfit silicone knife to remove gingival margin, papilla, and undercuts that engage teeth in order to make space for the second impression material. Cut sprue channels to allow the light body to flow up and out. Now, inject the light body for the second impression. Remove the cap and discard it. Use the mixing tip as the cap. Discard the beginning portion, 1 to 2 centimeters, of the light body impression material extruded by the mixing tip. Please don't reuse the cartridge cover cap. Instead, use the mixing tip to be cover of the cartridge after the second impression is taken. Inject Perfit light body onto the tray while ensuring the mixing tip is touching the blue putty to avoid trapping air. Incorrect usage can cause bubbles. Then, inject light body onto the patient's teeth. While injecting, capture the gum line and make sure that the oral tip always kept immersed into the material. Put the tray with light body into the patient's mouth, slowly and accurately placing it into position in one step. After about 3 minutes and 30 seconds, or when the material solidifies completely, remove the tray, finish the impression, send the impression with the tray together to your dental laboratory. To summarize, the two-steps impression taken with strong Masad low-temp tray and Perfit impression material not only saves time for both dentists and patient by eliminating the custom tray step, but also increases the accuracy and precision of the impression by high quality of Perfit impression putty and light body combination. For implant patients, the doctor can also drill holes in the appropriate parts of the tray. Transparency of strong Masad tray makes the process easily and fast. Send the impression to your lab with the tray together, which offer a good protection of the impression. To learn more about Nobilium and the two-step impression procedure featuring Perfit impression materials, please visit www.nobilium.com or call 800-833-2343. Thank you for watching.